Hello, I'm Lori Steiner, sitting in for Arvin Budish. Welcome to Golden Opportunities.
Today, can colon cancer be stopped? We'll alert you to the warning signs and prescribe preventions. Then, long-term care can also mean lots of money. We'll take a long look at how to cover those costs. Is your back bothering you? We'll speak healing words for your sore spine. And we'll reveal a new sinister government plan to cut Medicare coverage for nursing home stays.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Here's some good medical news. There is a type of cancer that is highly preventable, and we have the power to improve our odds. Which cancer is it? Colon cancer. Surprised? Well, Metro Health physician Dr. Jeremy Lipman might just have a few other surprises to share about colorectal cancer. Welcome to the show on this important topic.
Thank you.
Now, you said, and I introduced it as highly preventable. What does that mean?
Right. Colon cancer is one of the cancers that we can identify easily through routine screening and prevent. Getting a colonoscopy every 10 years once you hit age 50 is enough to identify polyps before they turn into cancer, get them removed, and prevent cancer from ever developing.
That's fantastic. How do you know if you need a colonoscopy? Do the polyps show symptoms, or is there something that will trigger you to think to do it?
They don't. There are no symptoms associated with it usually. Some people may see some blood in their stool, have some abdominal pain, but usually that's a sign that things have progressed. When you turn 50, then it's time to get a colonoscopy. Talk to your doctor and get it set up. If you have anyone in your family who's had cancer in their colon, then you probably need to be checked even earlier.
Okay. Is it covered by insurance? You don't have to worry about the big cost?
It's covered by insurance and easy to set up.
Okay. You just got to do it, huh?
Exactly.
So we have our first colonoscopy at 50, and you did mention to me that it should be age 40 for African Americans. They must have a higher incidence. Do we have to have one then annually, or how does that progress?
No, if your colonoscopy is normal, then you get 10 years free.
Oh.
So, and if they do find a polyp, then usually we'll look again sooner to make sure that nothing bad is developing.
Okay. What kind of risk factors or medical conditions might you be looking at your family for? You mentioned a few things, but...
Yeah, if your family has colon cancer, then that puts you at high risk. And if if you talk to your family members and find out that, they've had a lot of polyps removed too, then you should talk to your doctor about that.
Do other types of cancer lead you to worry that you might end up with colon cancer?
Yeah, there's some relation between people with stomach cancer, breast and ovarian and uterine cancer. People in your family that have inflammatory bowel diseases like Crohn's disease and ulcerative colitis, any of those things should get you to your doctor to have a conversation.
Okay. And if you do get in early enough and you get your colonoscopy, and it's clean, then you've got some time, but what if they do find polyps? What is the treatment procedure?
The treatment is done right at the time of the colonoscopy. We can remove the polyps and you leave there hopefully with everything gone. Now, if they do happen to find a cancer, having regular colonoscopies will help to find it earlier, and usually that can be removed with surgery, often done with small incisions laparoscopically.
So they don't have to cut you all open?
Usually not. Usually we can do it through the small incisions and get people home and back on their feet faster than doing it with the big incisions.
And does colon cancer necessarily mean they have to have that ostomy bag?
Oh, no. Yeah, usually not. Now, there are times when it's necessary, but for most people, for most cancers, that's not the case.
Oh, well, that's a good thing to think. You don't have to be all afraid of this whole process.
Exactly.
It's not so bad.
It's really not.
And since colon cancer is highly treatable, let's catch it early and stop it from happening.
Exactly.
All right. So, especially when it comes to cancer, it's nice to share positive news like this. And here's some more. Metro Health is offering a free information sheet on colon cancer. To order yours, use the information that's coming up next. My thanks to Dr. Lipman for joining us here today.
Thank you.
For a free information sheet on colon cancer, call Metro Health at 216-778-4131 or log on to www.metrohealth.org. Next, how will you cover long-term care costs? But first, today, on April 1st, we may pull a prank and then announce April Fool. But why would someone yell, April Fish? We'll reel in the answer when we return.
Good Neighbor Pharmacy locations accept your Express Scripts and TRICARE benefits. If you're an Express Scripts or TRICARE beneficiary, contact us today to transfer your prescriptions. You'll be happy you did. Find the store nearest you at goodneighborpharmacy.com.
In Bath, go to Colonial Pharmacy, or in Akron, visit Cope Pharmacy or Sand Run Pharmacy. For more information, go to goodneighborpharmacy.com. Good Neighbor Pharmacy, the best medicine for your health.
While we in America celebrate April Fool's Day, in France, April 1st is called Poisson d'Avril, or April Fish. French children tape a picture of a fish on the back of a schoolmate and then cry Poisson d'Avril when the classmate catches on.
We're living longer, but many times still planning like we're short on time. And that could especially be a costly mistake when it comes to long-term care. Jim Lineweaver is here to add up ways to cover those costs. Jim is a certified financial planner with the Lineweaver Financial Group. So welcome back to the show.
Thanks for having me.
We're talking about long-term care costs. I mean, what does that mean? Is it really that expensive we have to worry about it?
You really do. It's the single largest factor that people can face in retirement that can erode a lot of their wealth. And recently, MetLife came out with a study last year that said if you're going to look at like nursing home, home health care, assisted living facility, if you're going to physically be in a facility, and this is in northeastern Ohio, it's not all over the country, you're looking at $75,000 a year for a semi-private room, or if you don't like living with somebody else, up to a private room will be $133,000 a year.
That is just outrageous.
It really
and I
is.
don't think people really understand the kind of costs that are being faced here.
Yeah, it's a lot more than some people make in a given year.
Oh, yeah. So does that mean we all need to run out and get some long-term care insurance?
Well, you can look at it that way, but there's a lot of different ways to tackle this. One is if you went out and looked at the traditional long-term care, a lot of people can think it's pretty expensive, and if you never use it, guess what? You lose it, so you can throw all that money away. Other people may decide to self-insure because if they work it out with their family and with some gifting and advanced planning, they might be able to just take care of that on their own and, you know, pay the nursing home if they need to. But there's also some other alternatives on the insurance route that you can look at.
Okay, so what are those other options?
Yeah, well, there's a couple of ways you can handle this. One is looking at a life insurance policy, and the one we're going to talk about today is dealing with a lump sum going into a policy like that. There's other ways to pay it on an annual basis, but let's keep it simple for your viewers. What we looked at is a 65-year-old female, and if she has money that may be sitting in a savings or checking account, not really doing anything or earmarked for anything, she can put that into a long-term care policy. And what that would do is, let's say she had $50,000, she can do a dump into that, and what that would do is immediately give her a death benefit of $71,000. But it'll also have a lump sum available for long-term care. And what that does is actually picks it up all the way to $214,000, so that if she goes into a nursing home or needs skilled care of any type, then this $214,000 will be there for her to take care of her.
So how much can she get that out monthly, or how does it work?
Yeah, it'll actually come out to about $2,900 a month, and that can be used until that benefit is exhausted. And if she doesn't get over like that $50,000 of premium, then the family can actually get that back. But no matter what, even if she exhausts the $214,000 in long-term care benefits, she'll still have a $7,100 death benefit at the end.
Oh, still something to help cover the funeral or other types of costs.
Exactly.
Okay, so and this is just a one-time deal. It's a single premium. You pay and you're done.
Yes, exactly. And then they can just use multiples of that for other, measurements.
Okay. What if somebody's already got life insurance, though? And
Well, this is
they're
where you
needing
wanna
to
have-
add on something.
Yeah, this is where you want a financial checkup and to have like a life insurance review, if you will. There's a lot of companies out there that may be with who your insurance company is, and you can put a rider and attach it to an existing policy if you requalify for it, or you may have to look at taking that policy and possibly going with another company that can combine the life insurance and long-term care together into one policy for you.
Okay, so there's more than one option.
There is.
And you just need to investigate your possibilities. And I know that the state of Ohio has a new program. It's sort of a partnership program with Medicaid and long-term care insurance. And could you describe that a little bit for our viewers?
Yeah, this is a great benefit because the state's clearly stating that they don't want to pay for a lot of this stuff through the Medicaid system.
Absolutely.
So what they're doing is if you have a qualifying long-term care policy, and not every policy qualifies, so you got to check up front. But whatever benefit you have in a lump sum there for long-term care, the state's going to say that you can protect that amount of assets and put that off the table so that it does not come down in the spend-down rules before you qualify for Medicaid. It's a huge
So
benefit.
instead of if you're single, you would normally get to keep only $1,500 to get Medicaid.
Right.
And you've got a policy that's going to pay out $214,000 like your example. You get to keep $214,000 worth of assets?
Exactly, because if you're going to be proactive with the state says that they're going to reward you for that and allow you to protect more assets.
Okay, how do you find a company that offers that?
Just give us a call.
Give you a call. All
take care
right,
of it.
I knew you were going to
Right,
say something like
exactly.
that.
Happy to
All
help.
right. You may need to think long and hard about how you want to pay for future long-term care costs. But here's the short answer. Give Jim a call so you can understand all of your options. His number is coming up next.
Find out more by calling the Mineweaver Financial Group at 1-888-313-4009 or visit www.mineweaver.net. Next, a spine of the times. Looking for places to go, things to do? Welcome to our community calendar. Discover the little-known history of the Jews of Shanghai in the documentary Shanghai Ghetto at the Maltz Museum of Jewish Heritage, Wednesday, April 4th. Between 1938 and 1941, with other borders closed, 20,000 Jews fled to Japanese-controlled Shanghai, China, and this film shares their unique stories. For more information, call 216-593-0575 or click to www.maltzmuseum.org.
Would you like to go for a walk? It seems like a simple question, but for some, due to debilitating back pain, the answer is not a walk in the park. Dr. Nola Boot is here to walk us through reasons for this pain and a possible plan to heal it. Dr. Boot is with the Solon Spine and Wellness Center. Welcome again to the show. Thanks. I mean, any back pain can limit your movement quite a bit, but what kind are we talking about that makes even simple walking almost impossible?
Well, the one that probably is the most common is it's called spinal stenosis, and it might be called arthritis or degenerative joint disease, but typically a person with stenosis, you'll find them, for example, in the grocery store, you'll see them leaning over a cart. That's the only way they can really get through it, or they're shuffling and they're in a forward position, and if I show you a spine, you can see why they're in a forward position because it takes the pressure off the nerves. Okay. But the biggest issue is walking or standing. They feel like, I just can't stand in line for longer than 5, 10, 15 minutes, and their legs just ache and tired, and their back burns, and they need to sit down. And then after a 5 or 10 minute sit down, they're able to carry on.
Okay, well, what's causing that in your spine?
What it is that cartilage, or that disc that separates the vertebrae, has been eaten away. And so it's almost like bone on bone. And so you're sitting on it, and it's putting pressure on the nerves that go in the legs, so the legs just aren't getting what they need to get. And typically, the procedure has been, let's do physical therapy or inject medicine in there, and those are good options, but there is a technique, and that's what we use, called decompression, and it's the only technique that I know of that actually helps to restore or repair that injured disc.
So instead of simply treating the pain, you're actually trying to make the pain go away.
Right, but letting the bodies do it rather than an outside pill or drug or something like that.
Okay, so describe this process you're talking about.
Well, what it is we all know that if you've been in space and you're in that anti-gravity environment, we found that the disc material actually repairs itself or starts to grow because there's no gravity. So these specialized tables that we have in our office are $100,000 tables. They create this somewhat of like a weightlessness, and it draws blood and nutrients into that disc, and then the body can take over and start repairing itself.
So how do you create the weightlessness?
You're on a table and you're laying on your back, and it kind of gently stretches you. Some people call it the rack. It stretches from head to toe for 30 seconds, and then this way, very gently. That
doesn't hurt?
Not at all. It's very relaxing. In people with really bad disc ruptures, it's the first time that they can really feel relaxed because many times when you have a disc rupture, you're in acute pain and you're bent over.
You're
when they're on
tense,
the, when we do this, they can fall asleep and they say it's the first time I've slept, in weeks or months, and it's really neat.
And how long does each treatment take?
It's a half hour. So it's a half hour you're on the table, and it's a series of visits.
How many visits does it usually take?
Typically, what the research calls for is 20 sessions. 20 sessions, and we're seeing MRIs before, and then we're seeing MRIs after, and we're actually seeing change on the disc. And we are enjoying an 80% success rate over the past few years. We combine it with different muscle work, different exercises that we do, and but I'm not saying if you can't even walk to the mailbox that you're going to be able to run a marathon. Of course I'm not saying that, but I am saying we would sit down with you on your first visit and I would determine if I could help you. And if I could, I would say, here's a realistic goal that I think we can expect. Right now you can't walk to the mailbox. I think it's reasonable to expect that you should be able to walk a Home Depot, a 20-minute, half-hour walk. And if we mutually agree, we begin treatment, and we are 80% successful in reaching those goals.
Well, I'd say that's a pretty good success rate. So
yes.
Great information. So if a bad back has you sitting out of life, take a walk to your phone and give Dr. Boot a call. It may be your first step on the road to recovery.
Learn more by calling the Solon Spine and Wellness Center at 440-248-5070 or visit their website, www.solonbackpain.com.
It's time to get up and go. An exercise minute on Golden Opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and today we're going to deadlifts to work our lower back and our hamstrings. Alright, we got our dumbbells ready. We're going to stand with our feet about shoulder width apart. We want to make sure we stand up nice and tall and keep good posture. Now all we're going to do is keeping our legs nice and stiff. We're going to bend at the waist, bringing the dumbbells down in front of you as low as you can go, and then come up nice and slow, pulling your shoulders back, and once again returning to the great posture that we have. Okay, here we go. Down, nice and slow, awesome, and up. As you go, you will be able to get a little bit lower. Do not bounce or jerk during this movement. Always slow, steady, and controlled. All right, everybody, you feeling good?
Well, I got some feeling left, yes.
All right, everybody, now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
As we move into warmer weather, we may set our sights on hitting the links, digging in our gardens, or getting back on our bikes. But are our winter bodies really ready for spring sports? Today we've teamed up with physical therapist Jim Porterfield. He's going to coach us through plays that will improve our fitness. Jim is the president and owner of the Rehabilitation and Health Center in Akron.
Good morning.
So welcome to the show.
Thank you very much, Lloyd.
And a lot of people like me have been on the bench all winter. What should we know before we start suiting up for these spring sports?
Well, to go slow, start slow. Start with a small movement, then gradually get bigger and bigger. And if you find out that you're having more stiffness in the morning, then you have to just be careful that you could hurt yourself.
Okay. How about the weight we've gained all over the winter time?
Well, it'd be nice if we could just take a pill and have that all go away.
That doesn't ever seem to work that way, does it?
But it's a gradual process. The body responds to consistent stresses placed upon it, and if you put it to rest for 2 or 3 months and then take it out and start moving it, you're likely to get hurt.
Okay. You gain weight, you lose body mass over the years. You really have to make sure that you're stretching and moving and doing all the things right in order to really start doing some of these more important things.
Right. So as you can see here, the average American after 25 gains 1 pound per year, and and that's really not so bad, although that does really decrease your health significantly when we gain weight. But the key is losing lean body mass. The average American loses a ½ pound of lean body mass per year. So the average 55-year-old person is 30 pounds heavier and has lost 10 to 12 pounds they need to counteract the weight that they've gained, and they overload their skeleton and they have to decrease their activity.
Yeah.
Yeah.
All right.
And the average female loses 1/3 of her skeleton in a lifetime.
And that's a scary thought for us females.
Yes, so stay strong is the issue.
So if we're going to start working out or something, we're going to be a little sore, right? Is that normal?
Right, absolutely normal. In fact, you're probably not working out hard enough if you're not a little sore.
Okay.
But just start small and learn how to move without hurting yourself.
How about if you overdo it? You know, hey, you tried, you thought you were good. You know, everybody thinks they're 25.
That's correct. That's right.
And you get a little injury. You know, how do you get back from that?
Well, you just have to learn how to manage that. As you can see here that we have two circulatory systems. One's inside the blood vessel, the blood we always think about, and then there's a circulatory system outside of the blood vessel called the lymph system. And when we get injured, what happens is that the body swells and bleeds a little bit, and it creates a pain cycle. And stiffness in the morning is the key indicator of overload the day before.
Okay.
It builds up pressure, so injury causes swelling, swelling causes pain, pain causes protective guarding or spasm. It decreases blood flow, the fluid congests, and the area becomes regionally acidic. And we have nerves that, when they lay in an acidic environment, then spins this protective guarding mechanism. We're stiffer in the morning.
Okay. So how do we get out of this cycle and get back in the actual game?
Well, it's about working with the inflammation, learning how to keep the fluid moving so the body's healing process can take over.
Okay. Do you have to rest after an injury, or do you still work out slowly, or?
Yeah, you want to stay moving, but not in an intensity that's going to overload the tissues. Some of these tissues that hold our bodies together, like ligaments and tendons and muscle, take 12 to 16 weeks to heal. You can see here, this schematic just shows that when they come into the clinic and they have swelling and we treat it, almost everybody feels better, but we know it's going to come back. And then, so what we try to do is we try to work through the process of working and treating the patient. Their swelling goes down, they get more relief of pain for a period of time, and then once that happens, where the swelling goes down and increase relief from symptom, then we go to exercise.
Okay. So what's the best option here if we're trying to get back into the game? We don't want to get injured. How do we work that up?
Well, I would just keep yourself active throughout the winter. That's the main thing. And park at the further corner of the parking lot. Climb steps as much as you can. It's probably one of the best exercises you can do if your knees can take it. And just stay active and stay healthy.
And walk. That's what I've always heard.
Walk is good. And be a student of nutrition. Exercise and nutrition work real well together.
It seems to be helpful for everything.
Yes,
you know?
it does.
So.
It should be a part of the whole treatment process.
Instead of trying to be a weekend warrior, maybe try being a weekday walker. Then as your fitness improves, it can be game on. Need more training tips? Give Jim a call at 330-564-4100 or visit his website, www.rchhealth.com. My thanks to Jim for his advice.
Thank you, Lori, very much.
Thank you.
Next, don't let the government wrongfully deny you Medicare coverage for a nursing home stay.
Hi, I'm Trapper Jack at Nelson Vein Clinic, where varicose veins just fade away. Barbara is here. How long ago since the procedure?
3 weeks.
What did you notice right away after Nelson Vein?
It's all gone.
Pressure was gone?
Oh, it was all, yes.
Pain's gone?
Yes.
And it's covered by insurance.
That is one thing that got me here. That was a big relief. She's very good at what she does. She's terrific. You can hug her like I did.
Isn't it time you took care of your varicose veins? Call or log on to nelsonvein.com.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. And then find out the high price of not having a hospital stay. Medicare generally covers hospital inpatient care and nursing home rehab after hospital stay. But a sinister new trend could cost you thousands and thousands of dollars improperly. Here to explain is my law partner, Mike Solomon.
Hi, Lori.
Well, let's start with hospital coverage. What's going on that's depriving people of their rightful coverage?
Well, normally when someone goes in the hospital, if they're covered by Medicare, Medicare is going to pick up that entire cost. And that's good because it's very, very expensive. But this new trend that's happening is sometimes the hospitals will reclassify you to an observation status, and that means Medicare doesn't cover the hospital cost. You're treated as an outpatient, and then you have to pay for your own hospital stay, potentially, and any treatment that follows.
Wow, so you actually have to be admitted for Medicare to pick that up.
That's right.
How does this classification affect nursing home coverage then?
Well, many times when people are in a hospital, then especially older people, when they leave, they might have some rehab, so they go to a nursing home. So if you're, and typically Medicare will pick that up as long as you satisfy the rules. And that means you were in the hospital as an inpatient patient for 3 days or more.
Okay.
But if you're considered an observation status, then that doesn't count against the 3 days, and you could be in the same situation. Again, you have to pay for your own cost to be in a nursing home, and that also can be very, very
And
expensive.
we talked about earlier in the show how
That's right.
expensive it is to be in a nursing home, so you really need to have that Medicare coverage. So how do we protect ourselves?
Well, first of all, yell. If you're in the hospital and they're treating you in observation status, complain. Find out why they're doing that. And
You
then
probably have to find out that you are in observation status, and then you want to get it into admittance status, right?
That's right. And then secondly, if that doesn't work, you're allowed to appeal to Medicare, have a Medicare appeal, and the hospital is supposed to tell you how to do that.
Okay, so there's a procedure for that.
That's
Okay. And if those steps don't work?
Well, if none of that works, then there's an organization, it should be on the screen there, that it's called the National Nonprofit Center for Medical Advocacy. You can go to their website, and they filed a class action against the federal government for encouraging this sort of thing to try to stop it. And so that may be able to help you. Contact them, and they may be able to help you. And if that doesn't work, you can always hire your own attorney, but the trouble there, of course, it can get expensive.
Yeah, it's expensive as the nursing home
That's
can
right.
sometimes be. So, wow, this sounds like something we have to watch out for.
Yeah.
On top of everything else you have to worry about when you're in the hospital.
That's right.
That's
right.
horrible. So, yeah, if things, as I said, aren't hard enough, we now have to deal with improper Medicare denials of coverage for hospital and nursing home services. Your best protection is to understand your rights and to try to work with the hospital first. File a Medicare appeal if that isn't enough, and most importantly, don't give up.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.budishandsolomon.com.
Thanks for joining us. On next week's show, we'll check up the status of women's health. Plus, we'll share input on implants for your smile and invite you to a very special class reunion. So, until next week, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.